We're here in the Carlton Gardens with two fabulous women. Can we please get your names and why you're along here today?
Hi, I'm Ruth DeSouza.
And where are you from, Ruth?
It's a very long story. But most recently, I've come from New Zealand to Melbourne to work. So I've been here for 6 years and very excited about being here today.
Brilliant. And Fiona?
And I'm Fiona Patten, and I'm the member for Northern Metropolitan in the Legislative Council, and the member for Reason as well. So I am very invested and interested in the health services in my region and what I can do to advocate for them.
And she also has the best earrings on this Croakey walk.
Close up, please.
Local.
Fabulous.
Hello, Gorman.
Thank you. And there go my dogs being very naughty. So, can you please tell us about what you've learned so far today?
It's been a great morning on the CroakeyGO walk. I'm a mental health nurse, but I've done most of my work in New Zealand and in England, and I'm still kind of learning about the local context. So what's been fantastic was really getting in a bit of an idea about how the Victorian Aboriginal health system came about and how it was inspired through Redfern, which is a really amazing place for Aboriginal sovereignty and conversations. And it was great to hear about Alma Turner and how that came to be, and also how much care the staff at VAS put into kind of addressing the social determinants of health and really thinking about financial well-being and treaty and land, which are fundamental to well-being. So I really appreciated that conversation, and we've just come from the lovely cafe at St. Vincent's, which I loved, which was a sort of alternative to emergency departments. I've done some research with a student at Monash around alternatives to emergency departments, and it was just so lovely to see one that's so safe, comfortable, non-stigmatizing, non-pathologizing, friendly, warm, somewhere you would just feel was okay to go to. And I also know that in my own work, which is about racism and health, that people from culturally diverse backgrounds or people from Indigenous backgrounds often don't feel safe in mainstream services. And I kind of thought, well, this is somewhere where I can imagine a lot of other people would feel comfortable. So I've really loved our walk so far. And of course, great companions on the walk and good company.
Yeah, I think that's certainly that Croakey and Northwest Health have brought together so many people from different services. So it's just been, for me, been great having those conversations along the way, whether it's people from the autistic community or people from VOWS, which was wonderful hearing the history of VOWS. And I'm working on spent convictions at the moment, which really affects our Aboriginal community here. So just learning more about the holistic services that they've been able to do. And it's something that non-Aboriginal health services really could learn from. Absolutely. But my other passion at the moment is loneliness and social isolation. And in the UK, they've just set up a ministry for loneliness, and they've done a cross-government strategy. And one of the key areas and examples and reasons is because of lonely people presenting at health services, and in particular lonely people presenting at emergency. So it was really interesting to hear the St Vincent staff just reiterate that point and provide a much more positive place for someone experiencing loneliness and social isolation than sitting in an emergency with with a headache or whatever it is that might bring them there.
And one of the other places lonely people seek refuge is pokies venues.
Yeah, that's right.
Could you speak a little bit more about your interest in gambling reform, Fiona?
And look, I have a great interest in gambling reform, and I have been incredibly disappointed by the lack of movement from this government. Even just the small little amendments that we've tried to put through of limiting the hours that they're open, limiting the amount of money that people can take out of their accounts, even just limiting the speed of which those things go round. These were modest changes, and we couldn't even get those through. And yes, we know particularly for a socially isolated or lonely woman in her 50s and 60s, a pokies venue is a safe place, and it's a place that they can say they're going somewhere. So it's not the stigma of that social isolation. I'm going to the club.
That's right.
Where everybody knows my name.
And it's democratised problem gambling, hasn't it? It's the great equaliser, and robbing from poor people to fund rich people.
That's right.
Yeah.
And you know, we know, look, Crown's been in the news at the moment about their high rollers, but I think what really should be in the news is the low rollers.
Yes.
And the people that are, you know, losing their house, losing their life savings, losing their mental health in these areas, which also will affect their physical health. The cost of those places has got nothing. Crown has nothing compared to the cost of some of those venues.
Definitely. It was great to hear at VARS that they've got some gambling counsellors and are working on that.
I've also done some work in the problem gambling space, but mainly with international students and people from Asian and migrant backgrounds. Yeah. And I think one of the things that we underestimate is, you know, how hard it is to actually admit to needing help.
That's right.
And then finding the place, you know, knowing where to go for help. And I think that's where some leadership can be shown, which is what you're doing.
Exactly, and I think, you know, Melbourne University's been doing some interesting work on this as well. They've just set up a wellbeing hub, and that's recognising international students that they experience loneliness, social isolation, which leads them into having gambling issues or drug and alcohol issues, and to try and look at the prevention. And that's what we've been hearing today, that if we could prevent some of these issues, it will be far more cost effective than dealing with the acute, pointy end of some of these problems.
Thank you very much to
you
both.
And can I take your dogs home as well?
You can, yeah. You can pick which one you want. Hi, so we're at Drummond Street right now. Could you please introduce yourselves and tell us a bit about the programs that you work with?
I'm Claire. I use they, them, she, her pronouns, and I am a youth peer leader on the Queer Space Polaris mentorship program and a youth peer leader on the Youth and Communities Invisible program.
Fantastic. And how about yourself?
I'm Ari. I use they, them pronouns, and I'm a child and family practitioner, so a counsellor in the Queer Space family violence counselling team.
Okay.
Yeah.
And what do you primarily both work on while you're here, beyond the names of your programs?
I work with a lot of, so Invisible is a program that runs out of the city of Melbourne. We run events and programs for young cutie pox, so queer trans people of color from the ages of 18 to 25. And for Polaris, we are a mentorship program funded by the PHN, and we are basically doing a really cool organic matching mentoring program for the LGBTQ+ community that came out of a task force for suicide prevention.
Fantastic. And what about you, Ari?
Well, I guess a lot of my work is counselling work, and I work with young people, but adults as well, and families and couples. And essentially, it's family violence counselling, but it's prevention through to recovery, so it's really broad. And because of the high rates of family violence that we know that lots of trans people face, a lot of that prevention work, you know, is essentially like young trans people and their families, and helping those kind of new understandings of the young people to go smoothly, so that those people can have strong relationships with their families.
Fantastic.
Yeah.
And if you could see one really big change within the mental health system, what would you think would make a big difference to the people that you work with?
Well, one.
Just one?
You can rattle off a few more if you have them.
I think for me, like, the pathologization of trans people is a really big issue, as well as the kind of controlling nature that mental health sector has around trans people's ability to make decisions about their own body and presentation. And I see a lot of people kind of going through that process who actually require counselling in order to cope with what's supposed to be a therapeutic process. So definitely there needs to be more autonomy and self-determination, because we know that that's one of the protective factors for trans people in terms of suicide. Yeah.
I think for myself, it's recognizing or like overall kind of like decolonizing the mental health sector and putting First Nations people first. I think there's a big gap in that. Also, like spaces after you're a young person, what are you? And there's a huge gap. I think after you're 25, it's kind of like, well, labeled, go, bye. Thank you so much for your time. And like having spaces for people between like an elder stage and a young person stage, because then you're an adult, and that doesn't necessarily mean that everything has gotten better.
Fantastic. Thank you both for your time.
Thank you.
So we're at Drummond Street, and I'm going to introduce some of the staff here.
Hi, my name is Vicky.
And what's your role here, Vicky?
I am the team leader for the Redress Support Service. So I manage staff in the Redress Support Program.
Brilliant.
Hi, I'm Fiona. So I'm a child and family practitioner at with the Redress Support Service.
And I'm Kate, and I co-coordinate the Ready Steady Family program.
So, Kate, can you tell us a bit about your work?
Yeah, it's Ready Steady Family is like an umbrella for 4 other programs. So within that Ready Steady Families, you've got parent support, and that is for the perinatal period. So then it's prenatal, postnatal, 0 to 12 months. And that is parent support, literal and information, everything to do with becoming a new family. It can be for people that are sole parenting, coupled parenting, and anybody else that is co-parenting with them. And then within that umbrella of Ready Steady Families, we've also got Family Foundations, and that's a 10-week program that is a communication program, and that program is done as an outreach, as is the parent support program as well. And that is 2 coaches go out to the home per week and help people get on the same page about their communication around parenting. And then we have counselling as well, family counselling, and that's office based, but under circumstances that depends on the individual need. And then we've got groups and seminars as well, so that's based out in the community and wherever that's needed, and that's around the perinatal period. And everything else, it's with a mental health lens. So anyone that's struggling to come to terms with their new parenting role or parenting in general.
Okay, great. And Fiona, are there any particular threads that you find in dealing with people?
In my specific program?
Yeah, in your program,
Yeah, sure. Did you want me to sort of explain a little bit about what the program is?
Yeah, that's fine. Yeah, no problem. I wasn't sure if it was kind of covered off there. That was all.
No. Yeah, so it is separate.
Very
Two separate programs.
Awesome. Sorry.
No, that's okay. So yeah, just not to confuse. So basically the Redress Support Service program. This has been set up basically to assist people to apply for redress if they are victim survivors of childhood sexual abuse, childhood sexual abuse. So the redress scheme, the National Redress Scheme, came out of the Royal Commission into institutional childhood sexual abuse. It's a big, long sort of title there. And what we do is, so we assist people who are considering applying for the National Redress Scheme. And certainly if they are actually going to apply for it, we will assist them with that process. So being that we are working with survivors of childhood sexual abuse, there are multiple kind of issues that are happening. There's been multiple impacts on their lives. So what we try to do is we try to support them in that process. So it's not just about coming in and saying, we're going to write this application down for you. It's not that easy. So we're working with people who have, some pretty significant mental health issues. They've got very significant traumatic backgrounds, which includes, institutional childhood sexual abuse. It may include other forms of sexual abuse and, other kind of abuse as well. So really, the type of support that we provide also does entail sort of counselling sort of support as well. And a lot of that for us and for our particular clients is around sort of safety and stabilisation, sort of assisting them to manage some of their symptoms and things like that. And then to also, what you'll find is there will be other things that are happening. So there may be drug and alcohol issues, like I said, mental health issues, there may be homelessness issues going on, there may be identity sort of stuff happening. It's just basically looking really broadly at what's coming up for the person. Even things like there's a kind of connection and even with the NDIS, for example. So it really is about sort of working with where people are at around that sort of stuff. Yeah. And then the question that you mentioned before.
Oh, that's okay. I think you kind of covered off through that, so it's fine.
Did you want to add something to that?
Yeah.
Was it,
We also employed a family and loved one who we recognise that family members also supporting survivors. So we do acknowledging family members are also impacted by survivors of intentional child sexual abuse. So we employed a lived experience who is a family member. So that's also part of our work.
Fantastic. And I just spoke to you off camera before about if you could wave a magic wand and have one really big change to the mental health system, what do you think that would be for you?
I think the main important for a lot of what we face in the mental health system is I feel that a lot of mental health clinicians probably need a bit more understanding around complex post-traumatic stress disorder, but also around around where some of them still don't fully understand the impact on survivors of child institutional sexual abuse. It's a very long-standing issue. So we've got a lot of survivors who's very guarded around bringing mental health services, for example, CAT team, because of that trust, and also they feel judged by the mental health system. So that's one of the things I would like to see, to have a lot of survivors feel safe enough to bring triage, for example, mental health system. So I think that's one of the big changes I would like to see.
Fantastic. Moving along.
Yeah, I definitely agree with what Vicky's saying there. I think it's unfortunate that our current mental health system is really, it's more of a crisis response, and I think it would be really helpful to see more intervention kind of stuff, so getting people really early. And I guess just sort of adding to some of the stuff that Vicky was saying as well is just in terms of particularly survivors of childhood sexual abuse, there's a lot of distrust and having to open up their whole story for, to actually get a proper response is not always possible, I guess is what I was trying to say. So I guess more of that sort of awareness around trauma and working with childhood sexual abuse.
Fantastic. Okay.
I'm thinking probably to reduce the stigmatism around having to utilise mental health and having it as whole of family, and being able to not necessarily just address the adults, but have it as a whole of family program, being able to use the mental health guidelines and be able to address the children within the family, whether it be newborn or the first 5 years in particular, where a lot of mental health is actually starting to come out, and to be able to just reduce that stigmatism amongst the community as well as in the mental health field.
Thank you all so very, very much. You do very important work, and we really appreciate the time that you've taken with us today. Thank you.
Thank you.
We're just wrapping up the CroakeyGO for the day, and we're just going around and asking people if they've got a word from the day, or if they've got a takeaway that they'd like to mention.
I guess I'll go with a word, and I'm incredibly inspired after today.
Fantastic.
I'm thinking about social isolation and how so many organisations are trying to broaden their remit to include the broader social determinants, including isolation, which is something I probably don't think about often enough.
Okay, fantastic.
There's so many stories.
Seeing the mental health system is a huge job. It's overwhelming, and thank you to everyone who's involved in doing it.
Fantastic.
I think that it's clear that there are really passionate, caring people looking after the community, but it's a really fragmented system with lots of gaps.
If you'd like to know more about Jehovah's Witness child sexual abuse, please look up saysorry.org. Thank you.
Fantastic.
I really love the fantastic, rich stories that we got from not only the speakers but the participants in the group. So I just want to say a huge thank you.
Wonderful.
I feel really privileged to have heard the stories and are really grateful to those that have shared. Thank you for running.
The ability to connect with people and hear about not only the things that they'd like to change, but the things that have really helped them in their journey through the system.
Fantastic.
I think it's been great to hear people's experiences and just the wisdom they bring in terms of how we might think about what we do moving forward. But the thing that really resonates for me is connection.
Wonderful.
I think for me it's really about attitude. Everyone just came with just a great attitude to learn, to discover and to share.
Wonderful.
I think experiencing such a complex system and love the concept of no wrong door.
I feel inspired to generate some further change in our community.
Wonderful.
I think there's many issues that are happening at the moment in the mental health services, but there's also a really great mob of committed people that are trying to activate change.
Yeah, I just find that it was really interesting to hear about people providing services and working in the field with complex needs and also multifaceted, problems, and it's great to see actually people in action, doing wonderful work.
Look, I just want to say it's a really great initiative. It's been a really good day today, so thank you to everyone who's organised it and equally participated. So yeah, thanks.
It's been great fun and community and connection. They're my key words. Thank you.
Great to see what organisations are doing in terms of mental health service delivery, some fantastic people, fantastic services, but we can be doing so much more.
Yeah, I find today a very productive and interesting day. Yeah, but more conversation should be held to advocate for mental health. Beyond that.
Great.
Yeah. Hi, I feel so activated after today. So many people really want to improve things and make a difference. It's a really positive experience.
Brilliant.
Hi, I feel really motivated and determined to do better and aim higher. So it was a fantastic experience. Thank you to everyone.
Hi, as a new member to the PHN, I have to say that seeing the work that we fund and support really makes me proud to work for an organisation like this. I'm really honoured. So go hard.
Fantastic.
Hi, thanks for today. It was really inspiring. There's a lot of fantastic services out there, and I think it's about promoting the good news stories, which obviously this event does. So, yeah, fantastic. Thanks. I'm feeling really inspired to keep up the work and to see that there are great services out there that we're all really in it together and trying to make a difference, which is great. So, yeah, thank you.
Hi, I had a really great time chatting to everyone and hearing about the different services that are going on, and I'm really excited that even when social connectedness isn't the full agenda, it's on the agenda, and it was on all the agendas today for everyone that kind of gave us an idea of what their service was, and talking to people, it's something that everyone's talking about, and I'm really excited.
Hi, I thought it was a real joyful day. I loved hearing all the different stories and hearing and how people connected. So well done, Croakey.
And I think we'll just pull out and look at your t-shirt there, Paula, and say goodbye to Melissa and say thank you very much for participating, everybody. And we've had a great day, and hopefully everyone online has had a great day too. Thank you.
Bye.
Thanks, Rebecca. That's really good.
Do you want to say any last words?
Yeah.
I think a really fascinating, interesting day. As someone said to me, we also get you 10,000 steps at the same time. So the link between mental health and walking and being in the sunshine and talking to interesting people is inexorably linked. So I just want to say on behalf of Northwestern Melbourne PHN, thank you. I hope you had a great time. I hope that your insights got shared, that there was great listening, great talking, and what we'll do is bring this together with the Croakey team to have a really rich resource which will live out there publicly and will inform us in the work that we do. So, very much thank you.
Thank you, Croakey.
Thank you, Croakey.
Thank you so much. Engage with us, read us, write for us, tweet with us. We Public Health, where's Dave? Dave guest tweeted for We Public Health. Was that last week? It feels like years ago, but it was last week. Dave live tweeted the Mental Health Ageing Summit that Mari was covering for the Croakey Conference News Service. This week, Chris is at We Public Health. This is a collaborative platform. It has 13,000 followers and growing because it's diverse voices, experiences. So come and pitch to have a week at it. We want to hear from lots of different people. And yeah, thanks for engaging. Anything else, Croakeys? Anything else we should say? Mari's looking at me like I've forgotten something really important. Coffee! Yes, coffee! Any more?